Hi. Neuropathy is becoming, unfortunately, a very big issue. We look at some of the rates of how neuropathy care is growing, and it's really sad how it's looking out. And I know that there's a lot of options for people to get treatment. I want to talk about why our office is different. So one of the big reasons is we use a non-surgical, non-invasive way to be able to treat your neuropathy. We're not looking to just cover up symptoms. We're actually looking to see what we can do to reverse it. Now, if you've gone down the traditional medical route that, well, unfortunately includes mostly medications, unfortunately can progress even to surgeries, and they're really just managing symptoms as things progress. We do things differently here. One of the things that we're really looking for is, first and foremost, is this a condition we can help? Now, the way that we determine that is first our initial screening is, do you have the broad signs of neuropathy? The next is, it looks like it's caused by a condition that we treat, which is basically circulation problems. If it looks like one that we can treat, then we'll talk about proceeding with an exam. Now, one of the most important things that we do during our exam is what's called a pseudoscan, this device here. Now, what this allows us to do is to actually see the damage to the nerves and quantify it. We've had patients in the past prior to having this that many times ask, how do I even know if I have neuropathy? How do you know how bad it is? Well, we've had to do very subjective testing where we test the face and then compare that to the hands and your feet. We still do that. We still get great information. This is just a whole other level for what we're able to determine with patients to really quantify the damage to the nerves. Now, what that allows us to do is to really benchmark where you're at so we see how you progress through care, but even more importantly, tailor our treatment specifically for you so that we can get you the best results. Now, what this device does is by placing your feet here and hands there, it actually determines the damage to the nerves. There's a slight electrical current that goes through, and by your body's response to that, it sees the damage. Now, there's no pain with this. Some patients feel a slight tingling. Sometimes people get a little sweaty. But if you've ever had an EMG or an NCV, which can be extremely painful, this is nothing like that whatsoever. This is a huge difference that we have in our clinic to make sure that we're getting you, our patient, better.